Opioid overdoses have consistently been a problem for St. Louis County. The most recent data says the number of people who die from opioids in this area is double the statewide average and is the highest in the state per capita.
And some people say they have found the cure for the opioid crisis in medical cannabis, using marijuana as an alternative treatment instead of potentially deadly prescription painkillers. It's actually the most common use for medical cannabis in the state. The only problem is if you're a pain patient, chances are very slim that you're going to be able to find a doctor in this area willing to certify you. In the final installment of our special report, we are asking the big hospitals why.
It's a cherry vanilla liquid.
Relista Lindaki, a young wife and mother on the Iron Range, a woman who just last year was hooked on opioids, says medical cannabis has saved her life.
If I was still on opioids, I would be on something a lot worse. My brain was just telling me I needed more and more and more and more, and I felt like I couldn't control myself anymore.
But the medicine that freed her from addiction did not come from a Northland-based doctor. In fact, she says her provider at Essentia Health, who was supposed to be helping her reduce her dependency on opioids, told her that medical cannabis would not help her.
It was basically shot down right away.
The Minnesota Department of Health has a policy not to release the names of doctors who will give patients access to cannabis. This means patients like Relista are on their own to find a doctor if their current one refuses. Fox 21 is the first to get data from the state that shows just how big of a flaw there is in the Minnesota medical cannabis system. A glaring disparity in the number of doctors who will help legally qualified patients get access to cannabis in northern Minnesota. With just over 1,100 practitioners currently enrolled in the state's program to certify patients, only 24 are in St. Louis County. In Lake, Cook, and Aiken County, there are 0 providers. While more than 60% of cannabis-friendly doctors are in the Minneapolis and St. Paul region, even some smaller Minnesota cities have significantly more doctors certifying patients than in Duluth. The Rochester area has 172, and there are 37 providers near St. Cloud. St. Louis County's 2 major hospital systems, Essentia Health St. Mary's and St. Luke's, have never certified a patient suffering from chronic pain for medical cannabis unless they also have a terminal illness.
Our policy still is that we're not using that at this point for chronic pain treatment alone. What we try to focus on is treating that patient's condition, not someone coming in wanting a particular drug, whether it be medical marijuana or something else.
Essentia Health St. Mary's has something called a Medical Marijuana Oversight Committee, and Dr. Jeffrey Lyon is the chair. If an Essentia doctor thinks a patient could be helped by medical cannabis, a group of 8 doctors, 1 nurse practitioner, and a pharmacist meet. It's up to the 10 of them to decide if that patient should be able to use medical cannabis.
We try to exhaust the evidence-based treatments first. And really only after those are exhausted or not working to the satisfaction of the patient or the doctor do we then go on to think about using medical marijuana in that patient.
Dr. Lyon says about 50 patients total since 2015 have been approved by the Committee for Cannabis for various conditions, primarily terminal illnesses like cancer. The committee is a one-of-its-kind group. There is no other such process for any other drug prescribed at the hospital. That includes opioids like fentanyl.
How do you decide if it should be tried or not? I mean, if you're basing it on someone that could walk out of the hospital, die because of an opioid overdose, or they could try medical marijuana and their life be changed, how do you kind of, I mean, what's pumping the brakes on that?
What's pumping the brakes on it is that there's no reason to think that would at this point function as an appropriate substitute.
But a recent study by the Minnesota Department of Health does point in that direction. The state studied more than 2,000 Minnesota cannabis patients with intractable pain and found in the first year 60% reported significant pain reduction and 60% were able to reduce or eliminate opioid use. Only 10% reported no significant benefits from cannabis.
I think that there are any patients that are coming in here and maybe they're not being prescribed opioids because we're looking for these other alternatives, but they're not finding the pain management to be what they can live with, so they look for other options.
Definitely, yeah.
Do you think there's a way to fix that at all?
Well, I wish we had a perfect drug to treat pain that wasn't addictive, that had no side effects, but that just doesn't exist.
But some people would say that that could be medical marijuana.
And in some of the cases, some of the trials that they've done on just looking at pain control, medical marijuana has been shown to be effective for some patients with some conditions more than others.
What's kind of like the worst case scenario here if somebody is using marijuana?
Well, it's an intoxicating drug, and the worst case scenario is that they get behind the wheel of a car, or that they do something that's not, that they wouldn't do had they not been under the influence that hurts someone.
Meanwhile, at St. Luke's, the decision to certify a patient for medical cannabis is left up to the individual doctors themselves.
The only physicians that decided to register with the state of Minnesota were our oncologists, and that was for their patients that were already established in their practice who had some form of cancer.
That is 4 doctors out of a staff of 465.
What's at stake? What's scaring people off?
I think part of it is we don't know what the long-term effects are. Obviously, we've only had it in Minnesota for 4 years now, and so we don't know what the long-term 10, 20, 30 plus year effect of using medical marijuana is.
Chief Medical Officer Gary Peterson says the hesitation is all about the unknown.
Certainly there are political and emotional issues that surround marijuana in general. And I think many of our physicians feel like there isn't really enough hard scientific evidence right now.
What would qualify as enough research, do you think?
But I think what the medical community is looking for is research that involves large numbers, well-controlled scientific studies, placebo-controlled, double-blinded, and that's hard to do when you've got a substance that's illegal.
So what are the hospitals doing to battle the opioid crisis? It turns out the total number of opioids prescribed by the hospitals in the last year is not public information. Representatives from the Minnesota Prescription Monitoring Program say that, quote, providing data at anything lower than the county level could inadvertently identify a specific prescriber, dispenser, or patient. We do know that overall prescriptions for opioids in St. Louis County fell from nearly 150,000 in 2016 to less than 125,000 in 2017. That's a 12% decrease. Both hospitals say they're simply prescribing some patients ibuprofen or other physical therapy.
We're just giving them fluids, checking their heart.
There is at least one doctor with a satellite office in Duluth certifying new patients for cannabis. Dr. Adam Lockitz has his own private practice. He says he's confident in his decision to give hundreds of chronic pain patients access to medical cannabis. He believes he is saving lives.
We've had good data to support at least many uses for this for many, many, many years. Okay, these are political and other issues that are at play. Anyone who looks at this and says there's no science or evidence just has not looked.
But cost remains a major issue.
This program clearly was not designed for everyone. It was not. It was designed for people who could afford the structure of the way that it was set up.
A consultation with Dr. Lockitz will cost you $250. That fee will cover a year of care. The state charges $200 to be certified for the program. It's $50 if you qualify for assistance. 2 of the patients we talked to said their cannabis cost them $400 a month. That's a price tag of more than $5,000 a year. None of this is covered by insurance. The cannabis must be paid for in cash or with an ATM card. Dr. Lockitz says until marijuana is no longer federally illegal for medical purposes, that cost is unlikely to change.
It makes me feel that we're basically creating a concierge kind of a program, that we can't help folks who need it as much.
And if you missed any of the first 2 parts that we had, we talked to 3 different patients last night that have been helped by medical cannabis. Pretty interesting stories.
Oh, yeah.
And we also went inside the growing operation to kind of explain what medical cannabis is if you don't know what it is. And I know a lot of people think it's smoking joints. That's not what it is.
Opioid overdoses are killing hundreds of Minnesotans every year, and here's what you may not know. Far more people are dying from prescription opioids than heroin.
And many opioid pain medications are known to cause dependence, addiction, withdrawal, and of course, fatal overdose. At times, these are consequences for patients who were just trying to get relief from chronic pain. And now more people are turning to an alternative to treat their pain, medical cannabis. For many, it is working. But the hurdles that they had to jump through to even get it is raising a lot of questions.
This is where we live, in the country.
Life on the Iron Range is peaceful for Relista Lindacki.
It's private with the trees like that.
These woods are her entire life. Her mom lives close by. Her husband runs a business here. It's where she's able to raise her daughter. A new normal she doesn't take for granted after a medical nightmare a decade ago.
One day, I just got the worst headache I've ever felt. We had an MRI done on my brain, and they found that I had a cavernoma in my brainstem, which is a cluster of leaking blood vessels, which is very dangerous.
She needed 2 different brain surgeries, and doctors were not able to fix an unrelated spinal fluid problem causing shooting unbearable pain in her arm.
The doctors said, well, let's try some medicine because you're probably going to have chronic pain for the rest of your life. And we just have to manage it. I said, okay.
At first, the opioids worked for her, and then they didn't.
Then I started to notice my mood would change completely. I would just be moody and very unhappy. And my brain kept telling me that I needed more and more. And the pain was just there. It wasn't taking the pain away. Sometimes I would run out early and the doctor wouldn't give them to me for another day or two. And I would go through horrible withdrawals. On a scale of 1 to 10, my pain felt like a 20. Those were really hard times, and they didn't happen just once or twice.
What was left, a life hanging in the balance, alive but an empty shell.
There were days I couldn't even get out of bed. You get so depressed and down and you want to sleep and you want to isolate yourself. I isolated myself from my whole family. I didn't want anybody to know. I felt ashamed. Like I was the bad person, like I was a criminal for getting myself into this, for running out early. It was really, really, really hard. Really hard on my family and my husband. My husband had to step up and be a mom too. I couldn't take my daughter to school in the morning. That's not right.
Then Relista visited a chiropractor that brought up an idea that she'd never considered, medical cannabis.
And that made me nervous because when I think of medical cannabis, I think drugs, illegal, shame.
But desperation became more powerful than fear.